In the first session, we've got four speakers, and our first speaker is our old friend and colleague, Barbara Dooley. Barbara's just stepped down as acting registrar of UCD and deputy president, which she was for the past year. Barbara's a professor in the School of Psychology, and hopefully Barbara will become more active again over the next couple of years. And she's active in supervising and has a great research program running. And here's a list of some of her accolades. She's a member of the HSE National Office of Suicide Prevention Evaluation Advisory Group. She's Vice President of the International Association for Youth Mental Health, and a lot of you would know the big youth mental health survey that she did was recognised internationally as an extraordinary achievement in the field. And she's also on the steering group. She's a steering group member of the European Universities Association Council for Doctoral Education. And she's a member of the HSE National Office for Suicide Prevention Evaluation Advisory Group. And Barbara's going to talk to us today about establishing the National Student Counselling Database to identify trends in the mental health needs of third level students. So Barbara, we're really looking forward to what you have to say, but you've only got 15 minutes.
18.75. I have a few slides. So many thanks for the invitation. I'm delighted to be here. So I haven't been in the school, as you know, and I looked around, I was talking to Andrew a moment ago, and I was saying, oh my God, there's so many people I don't know. But I was delighted to get this opportunity to talk about a piece of research. It's taken actually quite a long time to get to the point where even now. So I have no effect sizes, I've only very little data, but I'm going to talk about a piece of work that will in time probably have significant impact in our understanding of the youth mental health of students right across the services in Ireland. So it's about talking a little bit about the establishment of this particular database. So we had a number of core aims to this project. If you're going back there, you'll see there's quite a number. So it was a project that was led out, it's funded by the HEA. Deirdre Flynn at TCD was the lead for the research with three main work packages. And the second one you might be very familiar with, which is many of you may have seen the National Suicide and Mental Health Framework and Suicide Prevention. That was a core output from Work Package 2 from this piece of research. I led out in Work Package 1 was to establish the national database, and there was a third one looking at peer support in third level. We've had 2 postdoc fellows so far on the project, 3 research assistants, one of whom, Andrea, has recently come on board and has begun to really get right into it, and I think she's going to be at the point where we're going to have some really useful data within the next year. So the core aim was to establish a national database for counselling services. Now, just to kind of dial back a little bit, why would you want to do this? So for years there were data collected across all the different, at the time, 21 institutions in Ireland, and it was all aggregate data. So people put up their averages for X, Y, and Z. The difficulty was there was no definition of what it was they were collecting, no definition with regard to gender, no definition with regard to presenting problems. To be honest, we were comparing apples, oranges and bananas, so you really had no understanding of what we were collecting. So the first thing was to actually set up the database with 3 steps. Have a standardised set of variables which were defined, and each service would use exactly the same definition. Now, to do that was a real radical change to get counselling services across the whole of Ireland to agree to one. I see Paul smirking over there, can understand the problem to do that. Then, once we have that agreed, to establish a database and then transfer the data from those services into a centralised database. And our final piece is to establish a practice research network. So using the data over time, trying to understand the type of data we have. So why would we need it? One, by having a national database, it allows us to identify student mental health trends in the population and subsets, for example, looking at different groups of students, extracting out maybe students that come through different pathways. What type of mental health issues are they presenting with? Do we need to look at our services slightly differently? Create sectoral reports, both local reports for their own institution and an annual report at national level. Bring more consistency to the assessment and outcome measures. So to get the services to agree on at least one core outcome measure so that we can look to see to what extent the service is having impact over time, and to establish the database for an evidence-based research on student mental health. Progress to date. So the first thing we did was we got an understanding of the current state of data collection in student counselling services in higher education right across the entire sector. And then this was done during, nearly just before COVID and into COVID, and there were 26 interviews with staff and directors. So every single service in Ireland participated in a qualitative interview to try and understand what they did, what they collected, and on the basis of that, we collated the outcomes from that. And the next step was taking all of that information, creating what we call the national data set, and presenting issue manual. Now, so then we kind of created what we thought would be the best or the optimal type of data to collect. And when we had that, we worked with 70 members of PSHE, which is Psychological Counsellors for Higher Education in Ireland, in May 2020 to get their agreement. And I can tell you, these are like quick steps over seconds. This took months and months of negotiation, working, building trust, because people often fear the sense of collecting data, transferring it centrally. Will my service be identifiable? Will I be profiled negatively? What will that say about what we do? So it was trying to build all of that trust was a major part of the work. And on the basis of the outputs from that, we developed the database, and then we worked with a company called Cloudtree, which have already worked with GPs in Ireland, so they had the understanding of how to collect data safely, GDPR compliant, etc., and put it into a safe database, encrypted, re-encrypted, and also the amount of work we had to do in that in the background again was enormous. And then once we got to that stage, once we were getting the services on board to work with us to upload data, we had to prepare ethics, legal documents, GDPR documents, things like data-to-data controllers, data-to-processing controller agreements, work with the DPOs of every single HEI across the country to actually, so the steps behind this were huge. And then we signed an MOU, a Memorandum of Understanding with PSHE to ensure the future governance of that data. So once we have established, how will we govern that into the future? And it's housed here in UCD, which is a big thing for us to actually have it here in UCD. And then we have now begun to collect data across a number of HEIs, and Andrea last Friday did some work for me so I'll have something at the very end. So there are three components to this data set. There's client data, counselling services data, and counsellor data. The client data has a whole series of information on demographics, presenting issues, routine, outcome, and it's all non-aggregate. So we've never had non-aggregate data before, and you can do much more sophisticated analysis presenting if you have aggregate data, non-aggregate data versus aggregate. Counselling services, they put up aggregate data, it's pseudo-anonymized, and we also have the counsellor data again at non-aggregate. So what type of service you have, and then the counsellors also put in their type of information and the identifier. Now to get even to that stage, counsellors agreed to put their own information in, took a lot of trust building. We have security features on the database, so both students and services remain anonymous. So even though we will collect the data, I won't be able to identify or anyone who works in any specific service. They have this unique identifier, and they can extract their own information. So we work at a collective, and we can broadly define the type of service and the type of institution that we have within the data set. We have the data obviously encrypted prior to being uploaded, and again, the power of this database relies on local data management systems. We were originally working with the Excel sheets. Like it was when we started this, there were some services that had very sophisticated systems called Titanium. Many of the services were using a system called Cornet, which was UK based, and some of them were using paper based, and some of them using Excel. Like you name it, they did it. But the HEA has actually invested in all of the services now, and they will all have access to a system that is electronically capturing their data. And in fact, we've slowed down our data collection because the majority of the institutions were working with Cornet, and now they're moving away from that to a new system called Mind a Client, which is going to be Irish based. And at the moment, they're only at the point of collecting data. So we're a little bit behind in collecting data on the basis of this major. And the main reason they changed from Cornet is because we began to identify some of the problems they had with Cornet. And they said, well, this is not fit for purpose anymore. And they're moving it away from that old system into a new system. So even that has had a positive impact within data collection here. So some of the details. So we have We have student demographics, we have status of students, the field of study, access routes, etc. Whether they have disabilities, mental health history, drug and alcohol use, the types of risks, such as particularly suicide risk. CHOW, which is counselling impact and academic outcomes, which is a standardised measure used across the whole system, presenting issues, and we're working on a standardised outcome measure at the moment as well. So that just gives a snapshot, and if you're interested in more information, that we have practically everything in open access on the TCD website, part of 3SET, which was the original project. But this just gives you a snapshot of gender, sexual orientation, geographic ethnicity study, etc. And all the definitions are over here. We have every single thing is fully defined, and every single institution is using the same definition. And this was a huge step change to get institutions to do this. Again, looking at what does contributing for a service mean. So there is an alignment of the routine data collection of the service with the SDS variables. So how they collect their data in their service is fully aligned when it's uploaded. They don't have to do any manipulation. They set it up at their own level so that it can be automatically extracted up, which makes it much easier. So they're not trying to figure out how we're going to get our data up that's actually done. It's built into the system. There's ethical permission, and some institutions really interesting, and all of you will know if you've ever worked with multiple institutions and on the one project. You'll go to one ethics committee and they want X, you'll go to another ethics committee, they want Y and A, and then somebody else wants A, B and C. And we had exactly the same issue, to the extent that one of the HEI said they didn't need ethical. So UCD has given us overall broad ethical, so we have broad ethical agreement, but nearly every single of the others wanted their own, but they all wanted something different, which is, it's extraordinary. I was at a meeting last week, the HRB, where we're part of the group, Ian, you weren't there, you've missed some of the ones I've been at, you've been at the ones I've missed, but in that, one of the things we were talking about is how do we have an ethics committee at a national level, particularly if you're trying to work cross different areas, and I think we certainly need that in a national issue. Again, the GDPR officer or GPO of every institution has to work through this. And then all of the data are de-identified, so before it gets extracted out of the system in the HEI, it gets fully de-identified, so only data that's de-identified is actually uploaded. So for the counselling services, what does it mean for them? The data collection process will happen as part of routine practice, so it's not anything new, so it's part of routine practice, which was really an important piece of the work. And again, one of the things is if there was a particular student in crisis, we don't actually ask for even getting consent at that point. So there's a whole lot of, I put that up there because there was a lot of discussion about when should you ask somebody, because they must actually consent to be part of this database. When would you ask and when wouldn't you ask? And we had so we built a lot of these kind of checks into the system, but not to the point where there's too many gatekeeping. The problem is, when is gatekeeping accurate and when is gatekeeping too far? So we had to really have a lot of discussion around that. The supports we provide, that's us within the team, and Andrea's getting fully familiar now with all the supports that we provide as part of this. So the whole next slide will give you give you an idea of some of the supporting documents. We help with ethics. We meet with the DPOs if necessary. We conduct a DPIA, a data protection impact assessment if required. We help with collecting all of the information, and we provide training on how to upload the data from the service into CloudTree. So that'll give you just a sense. All of these are up online, so we have a whole series of steps and processes that we can help any service to be involved in this particular system. And we also have worked out with our governance structure who will have access to the data from the research team, from the research who may collaborate on this with us into the future, and we had to have MOUs with PISHI on this, researchers with no collaboration, and all of the services and others such as the public. So these will be annual reports. We have different types of access, and we built this in at the beginning because we know in time we're going to have a very large data set to work from. Data storage, as I said, is with a company called CloudTree, which specialises in healthcare. It's also stored in Amazon Web Services based in Ireland. Again, all of these things took a lot of time to think about. If you've data that's housed, you're housing data, you have to make sure it's housed in European cloud, it can't be housed somewhere else. All of these take a lot of time to work through. We have legal agreements in place with CloudTree, and as I said earlier, we have an MOU with PISHI. So the software features, it's uploaded from directly from the services into, how many? Two, thank you. Encryption and decryption, very limited access, and multi-layered, and we also have an automatic data field check. So when it's going up, it'll only be uploaded if it's accurate. If there's a problem with any of the data fields, it'll actually come up as an error. And this works very well for the counselling service. And there's a record of processing activities. Again, really important from a data protection perspective. So we have this is so we can upload, etc. This is Cloud Tree. They literally have to click a button, so from where they're going to, and it'll automatically take it from the system. It's actually very sophisticated. It took a lot of time to get here. So as I said, it's embedded in UCD. We have a steering group, etc. We have the data controller agreements, and we have explicit consent. So really important that we had the protection of the data was key, as much as what we were going to collect. How do we protect the data? And then we have, this is some data, so on Friday, Andrea pulled some information from me. So we have 4 services have uploaded so far. 3 services have uploaded once, 1 service twice, on different platforms. I haven't identified the platforms in case we identified the institution, so we have a number of platforms so far. We've around 2,500, so we've moved from proofs of concept to actually doing data. But the delays, as I said earlier, was people were moving from Cornet to Mind a Client. So even here, so there's an agreed response with regard to gender and people. So we've male, trans, female, etc. I'm going to do that. Thank you. And then we just again information on sexual orientation, information on ethnicity. Really important things that we can collect at a national level, particularly presenting back to the HEA. And things like geographical region, living arrangements, all of these are important variables when we're trying to understand a bit more digging down about the mental health of students. And some of the top issues, anxiety was the number one. And I just presented from one main area, one institution that uploaded. And again, we've got depression and anger, interpersonal issues, academic issues, etc. But all of these are predefined, and that's the main important piece, and they across all of the sectors. And we've had a number of outputs to date, and our final report is quite interesting actually. Now all of these are up on the website. And that's me done.